think I decided quite late in my 12th standard, inspired by my aunt, that I wanted to become a doctor. So I went to medical school, medical college, did my MBBS. While I was there towards the end, when I was doing my internship and I was thinking of what I wanted to specialize in, I read about a dengue fever epidemic in Delhi, in India today. And when I read about it and the role of epidemiologists in it, that made it seem very exciting and interesting and very different from the way we used to think of epidemiology and community medicine as we had known it as medical students. So that really inspired me to take another look at community medicine as a specialty. And I had always liked the subject when I read it on my own, and I had several good teachers in it too. So then I went on to do my MD in community medicine, and when I was doing that at Manipal, I heard about public health, how public health training is very good in the United States. It was the buzzword what all students talk about. And then I investigated it further, and that seemed interesting to me. A professor from the US, Dr. Brian Cook, was on a Fulbright in our department, and he encouraged me to work with him at his university in the US. So then I went over there, University of Northern Colorado, worked with Brian, got my MPH. But I always knew, even when I was in college or maybe even high school, that I wanted to be an academic. I wanted to be a teacher. So when I was in the US, I knew that either I had to get the medical licensing in the US to teach in medical schools, or I had to do a PhD to teach in schools of public health. By then I was fully a public health person. So I went on to do my doctoral studies, and in my doctoral studies, I was always interested in social factors and health behaviors. And the more I read about it, especially with related to how to change behavior change programs, so to speak, that was very interesting to me. And the more I read about it, and I asked people where should I apply and look at, a senior professor at a conference said to me 2 words, Lisa Berkman. And I googled who Lisa Berkman was and found that she was at the Harvard School of Public Health. And I thought, while I'm applying to PhD, I will also apply to Harvard. But I was lucky, I got in, and I got a full scholarship for 5 years. So I focused on the social determinants of health there, which is why I'm able to call myself a social epidemiologist now. After that, so it was kind of, for me, a natural extension from preventive and social medicine, which has the social in it already and an emphasis on the social, moving on to looking at public health and community health without bringing in the medicine part. You leave aside the looking at things as a physician, and you start looking at it as an epidemiologist, but emphasizing on the social reality of human beings and how that affects health. And that was how I ended up with the social determinants of track, and finally as a social epidemiologist. So while I was doing my doctoral studies at the Harvard School of Public Health, I continued to have interest in doing research that is focused on India and India's public health issues. And my doctoral dissertation, I focus mainly on socioeconomic patterning in childhood undernutrition. Later I did my postdoctoral fellowship at the University of Michigan, where I looked at social determinants of health among African Americans, especially using a data set that came from Jackson, Mississippi. There I looked at what we call psychosocial, a lot of the psychosocial aspects of social factors impacting health. I'm also very much interested in looking at questions that will help people take action. And I have also begun to get involved in impact evaluation, especially using randomized control trial kind of methods. Interested in pursuing questions of health impact of technology. That would be a natural question for me to ask, given that I'm housed at an IIT. There is an understanding that of all social determinants, I think one that gets a lot of attention is maternal education. The levels of education of the mother of the young child, and catering to that, keeping that in mind, several behavioral change approaches, or even at the very minimum information and education campaigns are geared towards that. And So it's a very superficial engagement with social determinants. There is an acknowledgement that you can't just tell the mother of a young child, feed your child properly, give more food, and make sure the child is vaccinated and make sure there are no infections. That of course there is that much understanding that the message needs to be given in a way that makes sense to different strata of society, so to speak. However, engaging with the question of, when we know that maternal education is an important determinant, what are we going to do about it? That next level of engagement, I don't think there is enough, because there is always this defense that we are public health people, that is the business of the education. Whereas we can turn that argument on its head and say, if you are only public health person and you are not concerned with the department that builds roads, and then you see that pregnant women are dying because there are no roads, and then as a public health program you put together something that says we will provide transportation, how come the transportation ministry came into the health ministry? When common sense helps you make these connections, and then the powers that be, the policy makers and the program designers, come to it a little late, well, at least they're getting there. But so there is some level of engagement, but I think much more needs to be done. When a young woman comes up to me and she says, which is a social determinant and which is not, there is not a watertight compartment. She seemed to want me to give her a list of, ye dekho, all of these are social determinants and all of these are not. And I said that would not be the right way to approach this. If you want to know what constitutes a social determinant of health, you have to take a little time to understand what makes human beings social beings. What is the social aspect of our reality? There is the physical aspect of our reality with the body, and we're born as small babies and we grow up to be big adults and then finally we die, and there is the biological aspects of it. But there are also very important social aspects of what constitutes human beings and what constitutes human society. So being comfortable enough to go back and maybe even re-look at concepts that were dealt with maybe in social science textbook in 7th standard, 8th standard, 10th standard, even something like that, to make sure you get a little bit of a theoretical / conceptual understanding of what constitutes our social environment. Human beings as social animals, what do we mean by that? The social context, the structure of society, etc. That will help you see how age of a mother and how that influences undernutrition. Well, if you are looking at age as a biological molecular aging, then it's a biological determinant of health. If you are looking at age as a proxy for maturity and being able to deal with society, then it's a social determinant of health. So I would say go beyond this and apply knowledge based on a thorough conceptual understanding.